detecting the virus, which are currently being used. And these include Cobas SARS-CoV-2 test kit by Roche Diagnostics, Expert Express SARS-CoV-2 by Cepheid, BioFire COVID-19 test by BioFire Defense LLC, Abbott by Abbott Molecular Inc. With this approach, our capacity for testing will be expanded from our current 10 to cover at least one laboratory in each county. This is expected to take place in the next 2 weeks. We request that incoming applications are uploaded along with the requisite documents to the PPP portal. As shared in the past briefings, the current phase involves deployment of targeted testing with a focus on frontline healthcare workers, identified hotspots and clusters in Nairobi, Mombasa, enhancing community-based surveillance and screening trunk transit drivers. With regard to isolation and quarantine, we have 33 quarantine centers that are currently active. We have closed down a good number of sites. At the moment, we have 483 individuals in the various centers across the country. We have also quarantined 455 other persons for defying national curfew regulations. And I think this is important to note, because once you are out during curfew hours, it is assumed that you have now been exposed, and therefore, if you are taken, you'll be taken to a quarantine site for 14 days at your own cost. With regards to treating, our success on treatment is highly dependent on our ability to protect our frontline healthcare workers and heroes in this fight. To this end, we have distributed 4,759 complete personal protection equipment kits and 237 assorted components, i.e. goggles, surgical masks, N95 masks, gowns, rubber boots, shoe covers, etc. All quarantine sites and port health facilities have also received assorted protective gear.
Next on Corner.
I didn't find the money to gain anything. I found her because she's a child.
I'll tell you this. He has something that rubs me the wrong way.
Walter.
It doesn't hurt having an Oyange in our corner.
But be careful.
Of Pamela. She's barely a kid.
Don't be fooled.
Mbona unakuwaga na interest sana na hiyo gym? Na vile wewe ni sonko.
We thank both of them for this kind gesture. And I think that Amref is well represented here, as well as the managing director of Rockefeller, who is also here with us. Thank you so much. We really, really appreciate what you have done for us. And we hope that you don't mind if we become those people who are always coming around for seconds. Still on treatment, adequate supply of oxygen is crucial in the management of COVID-19 disease. Towards this, I am appealing to national and county health facilities to settle any debts owed to oxygen suppliers. Those holding oxygen. And we have also a number of oxygen plants of our own in the facilities. However, let me also caution that facilities with such plants should make haste and repair what is not functional, because I'm aware that there are some oxygen facilities that are not functional, but also do a quick cost-benefit analysis to ensure that when you are planning to build a plant, an oxygen plant, ensure that you are getting value for money. Because I am aware that there are some plants that were built by some Czech companies, Slovak companies, that no longer can be serviced because there are no spare parts for some of them. So I would like to urge that before counties and other hospitals think about putting an oxygen plant facility, let's think hard. Perhaps getting it from local suppliers might actually be cheaper and getting them serviced. In any case, hospitals are not experts at running these oxygen plants. And I think that if you do get a hospital plant, then you might require to do a management arrangement with a company that can settle them. Otherwise, you will have them all over the country, but half of them will not be working.
Next on
This week on Grapevine,
we got you covered.
On March 8th, he made history with a live-streamed performance from his home that saw tens of thousands of Kenyans tune in.
Kudos to Nyashinski. I think that's exactly how to do it. And if a Kenyan artist has done it so well in Kenya, I think so many artists can follow suit.
It's last year when I got my breakthrough, but after 2 years of going for auditions, probably above, almost over 15 auditions.
see you all tonight, 10 p.m. only on Grapevine.
What you gotta do?
On the next episode of Elena's Ghost.
Why can't the child just be born already? I'm so sick and tired of being cooped up within these four walls.
Not gonna wait any longer, Julia. The moment has arrived for you to transfer the old woman's fortune to me. It's time for me to have my inheritance.
What's going on? Miss, what were you going to tell her?
I told you that I'm not going with him. Please, just call a taxi.
Elena.
This Monday on KBC Channel 1.
Sijalishwi na motives zingine anaweza kuwa nazo.
In Machakos, for instance, in Machakos, from Syokimau, one from the two from Syokimau, and there is one each in Athi River, Kamulu. We have a case now from Kamulu, Ruby Garden Estate. We have a case from Kithunguni and Viranji. In Kiambu, we have a case each of the following estates. Githurai has a case, Githurai 45, Dongoru, Edegua, Tinganga, Waidaka, and Wataalam. Kajiado 2, we have cases in Kitengela, in Matasia, and Ongata Rongai. In Muranga, we have 2 cases in Gatanga and Lumumba Drive. All these cases are being treated in our various hospitals, and we hope and pray that they will soon be cured. But the reason for mentioning the specific areas is to establish and to show you that it is not a Nairobi disease, it is not a stranger's disease, it is something in your neighborhood. It is something that is being carried by a brother, a sister. It is something that is within a friend that you have, and therefore it is just to emphasize the need for social distancing and the need to be just careful as we move along. They need to be just careful as we move along. I think if we do that, if we are careful, then we can continue to contain this disease. You will notice that it is growing. As you can realize, Mombasa, 7 in a town in one day in Mombasa. That is not a small number by any standards. And if you can multiply a factor of 4, it tells that if you do not withdraw those people from the town, then each of them will go and multiply by 4, and there goes the exponential figures that we have been talking about. So today, ladies and gentlemen, members of the press, the reason why we are here is essentially to take care of our frontline people, to ensure and to encourage them, and to tell them we are thinking about them. As you are aware, the president ordered that we start thinking about what sort of encouragement we can give further in terms of welfare to our frontline workers. And I can confirm to you that these are ongoing discussions, and we will be announcing soon what we have agreed upon. And I can also confirm here that in addition to the government, there are also many people in the private sector who also want to do something. And this is also work in progress. So stay encouraged, stay safe, more than anything else, stay safe. As you are aware, in some of the countries that the disease has infected people, and I think in Spain, for example, it was about 10% of the infections were healthcare workers. Here, we do not want to hear of anything like that. We want to ensure that our health workers are the ones who are protecting us, not us treating them. I want to thank you very much. Thank you very much.
From April, maybe to Dr. Amoth, last time you did say that the month of April will be a month of reckoning for Kenya. Maybe with only 10 days left for this month of April, you do still hold that indeed in the next few days we do have to brace for hard moments as a nation?
Thank you, Kaemba. That was fun, but not mine. Yes?
The question that I have is with regards to the sample size that you have tested in the last 24 hours and cumulatively, as well as what is the plan going forward for those patients that are being released? What, in the case of a reinfection, what is the plan?
I'm going to let Dr. Amoth respond to the technical issues, but let me just talk about the numbers we have tested so far in the country. Yesterday, we tested fewer than the previous day because of a shortage. There is a global shortage of one of the items that we are using, and we are hoping that we can get it between today and tomorrow. Essentially, it is, what do you call the nose of what? Whatever, that one. The one is sticking in your nose. And this is the one that we are asking our people here, that this is not something we should be buying from China, really. Some sharp business person should be making these things, and we have got a big market. But so we have in total in the country 13,872 samples have been tested so far. Dr. Amoth?
Thank you, Waziri. I think we have had various modeling plans. And the first one, of course, is the one we talked of April being our time of reckoning. But if you look at the samples that we have tested, because of the global supply challenges in regard to testing kits and the commodities used for sampling, we have not hit the number that we had anticipated going forward in terms of the numbers we were expecting to have tested by then. So we'll still stand by that. And we hope that going forward, as we'll be able to test more figures, we can reflect back and see if those figures match what we had postulated earlier. But now that I have the floor, I would also want to take this opportunity to inform you that we have been in discussion with the manufacturing industry. Today we had a meeting with Bedi Investments from Nakuru in terms of local manufacture of PPEs, personal protective equipment. And yesterday we had a meeting with Shona EPZ from Athi River. And we want to confirm to you that these two industries met the threshold for manufacture of PPEs, and that their PPEs have been assessed by KEBS and the top leadership of the ministry, especially the users, the doctors, the nurses, the laboratory people. And we are confident that we are going to deploy these PPEs for, not only for Kenya, but for the entire region going forward. Despite this challenge, I think this has been a very big opportunity for us Kenyans as great innovators, so that going forward, we should be the leading country in terms of local manufacture of PPEs. And we are also in discussion with the Ministry of Industry to start local manufacturing of small consumables, like what Waziri was talking about, the nasopharyngeal and oropharyngeal swabs for local use and even for export. Thank you.
Yes, let me invite him. Thank you, Waziri. Ladies and gentlemen, the first thing I would like to say is that I would want a moth to be wrong. Models are made so that you're wrong. They're not made so that you achieve them. Models are made so that government plans and you get them wrong. If they get them right, then there's no need of modeling, because then it means you didn't plan. So we hope a moth is wrong, but we hope he's right to allow us to plan. That's really important to understand. So don't look for the numbers, look for the action. The next thing I would like to say is that in this line of defense, in this battle, we have two lines of defense. One is individual, you and I. So please let us obey what the experts and the government are telling us, so that we can apply that first line of defense. The second line of defense is our health workers, our doctors, our nurses, our clinic officers, our lab experts, our community health workers engaging communities out there. And these need to be supported and need to be protected. And this is what Waziri has spent time talking about today. So I would really like to thank Rockefeller Foundation, because when the call came from KNH and the ministry saying we need to protect and support our health workers by putting up a center that is for them in case you have any incidences, Rockefeller came forward, and we really wish to thank you. We have they have donated about 100 beds, which are going to be put into these centers. They have donated preventive equipment that are going to be used, ventilators. and monitors for standby. We honestly hope they are not used at all, but it's always good to plan and have them on standby. So what I would like to do is ask the Rockefeller MD, Mr. William Masiko, to make a few remarks. Thank you.
Thank you very much, Dr. Githinji Gitahi, Waziri, and the rest of the senior management team from the Ministry of Health. First of all, mine is just to thank you very much for your precise leadership, transparency in this fight. When I came to see you nearly 2 weeks, just over 2 weeks ago, Waziri, you told me that you do not want words, you want action. And I'm very glad that in just under 2 weeks, we have been able to come and support you in your strategic fight against this enemy that nobody could have foreseen coming. Thank you very much for giving us this opportunity to serve you. Our frontline healthcare workers are sacrificing so much. And as you said, in many countries, they are even giving the ultimate sacrifice by giving up their lives. We do not want to see that here. And we are very, very, very happy to support this. And as you said, we hatutachoka. We will stand by you. We are here. We are in the beginning of this fight. Nobody knows where it is going, but we will be there throughout. Thank you very much for this opportunity.
Thank you very much, William. And so that you can see me, I'll remove this and then I'll put it back as well. And this is how you hold it, not on the mask itself. I would now like to ask the health workers themselves to come and make some remarks because they are the people in the front line. So it's always good to hear from them. So I'd like to ask the chair of the Nursing Association to come and make a 1 minute remark.
Thank you, Honorable Waziri. On behalf of the nurses and other healthcare professionals, I just wish to extend our gratitude to our partners, Rockefeller and AMREF, for this help that they have extended to us. And as you've said, we don't wish to get there, but we must be ready in case we reach there. And I also want to urge that the package, the welfare package that was announced by the head of state, His Excellency the President, Uhuru Kenyatta, be unpackaged, and we hope that it will be commensurate to the sacrifice that health workers are giving at this critical time. Asante sana.
Thank you very much. Yeah, you can clap. I would also like now to invite the chair of the clinical officers to also make a remark, and then I'll ask the president of Kenya Medical Association to follow, who is here with me. So clinical officers, yes.
My name is Manasseh Bosha. I'm the Chief Clinical Officer in the ministry. Waziri, we want to thank you very much for your initiative to have this facility to take care of frontline health workers. As you know, clinical officers have been first affected with this COVID-19 disease. And the question they've been asking is, if we are isolated, are we going to pay for ourselves? But now with this answer, we want to thank you very much. Thank you so much.
The president of KMA.
Good afternoon, everyone. I really want to take this opportunity really to applaud each and every healthcare worker, not just the doctors, the nurses, the clinical officers, the lab technologists, radiologists, every one of us. Thank you for standing out there and being on the front line of this battle. This is a different battle where it's the healthcare workers who are at the front. I want to thank the government too for the effort it's making in ensuring that these healthcare workers are protected and that they have adequate PPE. They need to be safe so that they can work and make sure that they keep the population safe. Of course, in the line of duty, remember these healthcare workers are just like you and me. I am one, but all of you out there, everyone has a fear about this COVID-19. So let's not imagine that the healthcare workers do not have a fear as well. And they are working under a lot of pressure. So as the Kenya Medical Association, in association with the psychiatrists, the clinical psychologists, we've set up weekly debriefing sessions to ensure that they also have psychological support. Further to that, we're also making sure then that the healthcare workers are trained. We are using innovative methods, ICT, to ensure that they also know how to protect themselves. In the line of duty, some people will get affected and will be exposed and may turn positive. And indeed, we are very delighted today that this building here that has been launched for making sure that there is an isolation and treatment center available to healthcare workers is something the healthcare workers of this nation will be proud of. Thank you very much, Rockefeller Foundation. Thank you very much, AMREF. Thank you very much, Ministry of Health, for taking care of the healthcare workers. Would also like to urge the healthcare workers, knowing that even as we get exposed, that we need to take this opportunity to ensure that we come in for testing, that we get tested, and that if we are tested and have been exposed, that we do follow quarantine rules. They apply to us as well, and this is for the loved ones, our families, and for the benefit of the patients. All of this is to ensure that we are all looked after in a humane manner. So I will just conclude, Bwana Waziri. For us as in the medical profession, we do have a physician's pledge. And in that pledge, this is what we say at part of it. As a member of the medical profession, we solemnly pledge to dedicate our lives to the service of humanity. The health and well-being of our patients will be our first consideration. We'll respect the autonomy and dignity of our patients and will maintain the utmost respect for human life. So stay at home, keep safe, keep social distance, wash your hands, and ensure that when you stay that way, you also keep us as the health workers safe so that we can serve the community better. Thank you.
Thank you very, very much. And I would now like to invite Kefa to speak on behalf of the public health professionals, because they are also in the front line in this response. Kefa, please.
Thank you very much. I think what we want to say is that we are very happy with the moves of repackaging and support to the health workers wherever they are. Our call to all public health specialists, public health officers, and public health specialists fraternity is that this is our opportunity to give our best. And indeed, the call for this moment is the highest basic observation of what requires to be done. And I think I want to call our colleagues, wherever they are, to give their best on behalf of Kenyans. This is the only time that we can give our best. Thank you so much.
Thank you very much. And finally, the chair of Kenyatta National Hospital Board, so that he can then receive the equipment.
Waziri and all the health professionals here present today. Allow me, Waziri, to start by thanking you most sincerely from the bottom of my heart for the dedication, commitment, and selflessness that you have shown in the fight against this disease. People can be given jobs, but many times people do not lend their hearts to those jobs. And most of us, Waziri, believe truly that you've lent your heart to the fight of this disease, and through your leadership, Kenya will be much the better in confronting and defeating the disease. Ladies and gentlemen, we are here today to hand over the isolation and treatment center for our frontline warriors in the fight against COVID-19, the healthcare workers. We must all appreciate that above everything else, healthcare workers are also human beings like you and me. They have anxiety, they have fears, they have families. They don't just need this kind of support, but they also need psychosocial support, and that falls upon you and me to do it. And therefore, in that regard, I thank most sincerely AMREF Foundation and the Rockefeller Foundation on behalf of the Board of Management of Kenyatta National Hospital for this timely event. This timely donation is going to go a long way in making sure that we at all times communicate to our healthcare workers that we do care about them, we do care about their commitment as the frontline fighters on this disease. Of course, it is our hope, like Waziri said, that we don't admit a single one of them into this facility, and that's really our prayer. And I think from where we stand, Waziri, we have a lot to learn from the mistakes that other countries have made. We don't want to repeat those mistakes. But most importantly, to AMREF and the Rockefeller Foundation, what you've done today goes to show what we need to do as the global community to be in order to be able to confront and defeat this disease, which is international collaboration. This disease does not know about social status. This disease does not know about who your father or your mother is. This disease does not know where you were born, how much money you have in the bank. As a matter of fact, some people, I'm told, when I was just being told yesterday, some of the most worried people today are those who have big bank accounts in other countries which they cannot assess disease. So really, this is what we need to do. As I conclude, Waziri, there's been this misinformation as Kenyatta National Hospital that now we are not doing anything else other than dealing with COVID-19. Nothing could be further from the truth. As Kenyatta, and on behalf, and because we are the leading healthcare provider in this country, we are the apex institution in healthcare provision, I want to assure you that we are all still attending to all other clinical conditions. Of course, this is a priority, it's a global priority. It is a priority for the nation, but let no one tell you that if you come here with any other clinical conditions, will be turned away. We are here to receive you, and we'll be doing our best. And I want to thank our frontline staff, especially those at Kenyatta National Hospital. They have gone beyond the call of duty just to make sure that we are all assured and we are all kept healthy. And wherever you are, whether in the media or wherever you are, wherever else in this country, please, we owe it to make sure that we give them psychosocial support, any kind of support, encouragement, so that they know the whole country is behind them. I thank you very much. May God bless you. May God bless our great country.
Yes. So we now hand over the bed to the Ministry of Health and the Chair of the medics and the health workers as well.
Next on
takwenda popote ulipo, napasa kwenda kuwa pamoja na yeye, angalau anaweza kuhisi auheni.
Sikiliza, nitakusaidia, nitakuokoa, nisubiri tu hapa, nitamrudisha Loyuju.
She's a child. I'll tell you this. He has something that rubs me the wrong way.
Walter. It doesn't hurt having an Oyange in our corner. But be careful. Of Pamela? She's barely a kid. Don't be fooled.
Mbona unakuwaga na interest sana na hiyo gym? Na vile wewe ni sonko.
Towards the ovary, where we are going to get the female cells. And now remember, I said this pollen tube is carrying the male reproductive cells, and you can see, because it is carrying the male reproductive cells, definitely the cells will be released towards the end of the tube, and you can see I've indicated where the pollen grains will be. And then we once the each tube enters on the ovary, we will find the ovules inside the ovary. In our next lesson, we'll be talking about parts of our seeds, and you come across a part that is called a micropyle, which gives the beginning or the opening through which the pollen tube will be able to get into the ovary in order to fuse with the female cells, and therefore allowing the fertilization to take place. And that one is being explained in my diagram number 4. Remember, I said the pollen, here diagram 3, we showed the pollen tube has increased in size. It is trying to enter the ovary. This is the ovary. In number 4 now, you